Madam President, first let me thank the Democratic leader for his statement on a better deal for all Americans. I had a chance over the weekend to travel throughout my state, and I heard over and over again people in Maryland talking about what we need to do on a better deal. I had an interesting forum on health care, and Marylanders want a better deal on health care. What they mean is they want to make sure that health care is affordable, that they can get access to quality care, and they can make sure that we maintain the highest quality health care. What they don't want to see is us moving in the wrong direction. And I heard that over and over again, Madam President, about their concerns of what is happening with the consideration of the bill that the Republican leadership is anticipating having a vote later this week. That bill would proceed on legislation that would eliminate health care coverage for at least 22 million Americans, maybe as high as 33 million Americans. And I must tell you, that's not a better deal for Americans on their health care needs. We can do much better in moving in the opposite direction, on making health care more affordable, not cutting people out of health care insurance. In my state of Maryland, in 2018 alone, 221,000 people in my state would lose coverage under the proposals that the Republican leadership is suggesting, including 4,200 veterans, 164,000 people in the Medicaid system, and 62,000 people in the individual marketplace. That's going to hurt. These are people today who have health coverage who would lose their health coverage. It would hurt our seniors in the coverage they get under the Medicaid system for long-term care. It would hurt those who are working to try to end this opioid drug addiction issue. Under the current law, mental health, behavioral health, drug addiction, it's covered under the essential health benefits. It's covered under private insurance. It's covered under the Medicaid system. That is in danger of being lost under the legislation being considered. So I heard from public health law enforcement over the weekend how that would move our community in the wrong direction if those bills were considered. I also heard from the majority leader that all he wants to do is get on this bill and then we can offer amendments. Well, that's not accurate. You can't offer amendments, any amendments you want on a bill that's under reconciliation instructions, and we certainly aren't going to get a fair shot at trying to make this bill a better bill under the restrictions on which we are operating under. We had no committee hearings. We had no committee markups. That's not the way in which legislation should be considered. The other issue that I heard from people in Maryland, I think you'll hear this from people around the country, is they want to bring down the cost of their health coverage. They want to bring down the cost of their health care. They want to reduce the high growth rate in health care costs in this country. And yet the Senate Republican bill increases the average premium by as much as $1,700 in Maryland by 2020 and preserves what we call the age tax, a 5-to-1 difference. So if you happen to be 55 years of age, you're going to pay a lot more than that increases in your health insurance premiums. That's not what people in Maryland want to see. That's not what people in this country want to see. They're concerned that we should be building on the Affordable Care Act to bring down the cost of their premium increases, not to increase it by that dramatic amount of money. The increase in deductibles in Maryland could be as high as $3,300 for a person making $42,000 per year and $5,600 for a person making about $18,000 a year. That's increases in deductibles. They can't afford that. The concerns we have, people like the Affordable Care Act, they want us to improve it. They want us to improve it. They don't want us to add to their costs. And the bill that the majority leader is asking us to consider would have people in Maryland and around the country paying more, not less, was what they want. So the people in Maryland around this country like the consumer protections that we have under the Affordable Care Act. They like the idea that there's no annual cap or or lifetime cap. I had several people who came up to me to tell me about their own personal circumstances. One father explained to me that his child was born with serious issues and that they reached their cap within a matter of months. Without the protection in the Affordable Care Act, they would have had no other insurance coverage. And yet, under the bill being considered by the Republican leadership, that family could lose that protection because you could see the imposition of caps. All of us know of people who are very concerned on pre-existing conditions. The bill that's being considered under the Republican leadership weakens those protections for against discrimination on pre-existing conditions. Let me just remind my colleagues of what we saw before the Affordable Care Act and discriminatory practices by private insurance companies. We have reined much of that in under the Affordable Care Act. All of that could be lost if we proceed on legislation and move it forward that doesn't provide the consumer protections, allows the elimination of caps, allows discriminatory practices in regards to pre-existing conditions, restricts the amount of money going into the Medicaid system so that our states are forced basically to cut back on the Medicaid system. We lose the expanded coverage. The Congressional Budget Office has already told us that. And we go back to the days of job lock. And I want to talk about that for one moment because I think this is one of the untold stories. I haven't had a lot of discussion on the floor, but if you go in the wrong direction, and you do what the Republican leadership is talking about doing and repealing the Affordable Care Act and either repealing and later replacing or replacing it now with a program that will eliminate a lot of coverage and again, once again, eliminate these consumer protections that we have in health insurance, what you do is people get locked into employment. They're afraid to leave their jobs because they have the insurance that covers their family. They have a spouse with cancer or they have a child with a major disability. And yes, they would like to do what this country is best known for, and that is set out with entrepreneurship spirit, start a company or go and take risks. But they can't do it because they know they are jeopardizing their family's health care because they can't get the type of insurance that they need to cover their risks. That's called job lock, and that works against the growth of our economy. So there are so many reasons to be concerned about what the majority leader is asking us to do to proceed on this bill that all the options we've seen will cost millions, tens of millions of people their coverage, take away a lot of the consumer protections that we've seen in the law and discriminate against our elderly, discriminates against minorities and women. That's what we'd be returning to our healthcare system. No, that's not the right way to do. Now, Madam President, I'm frequently asked, well, what should we do? Isn't the Affordable Care Act, doesn't it have problems? Doesn't it need to be fixed? Well, the Affordable Care Act has done a lot of good. It's given people coverage who never had coverage before. It's reined in the discriminatory practices of health insurance companies. It's made a dramatic improvement on dealing with minority health and health disparities. It has provided essential health benefits so that we deal with mental health and addiction. It's done a lot of really good things. But yes, we could improve it. There's never been a major law passed without us coming back and revisiting it. So why haven't Democrats been part of this process? Well, Madam President, we could not get engaged in this process because the way this bill came to the floor, it didn't come through the Health, Education, Labor, and Pensions Committee. It didn't come in through the Finance Committee, the two committees of jurisdiction that deal with the healthcare system in this country. Instead, it came in through the majority leader using the Rule 14 process to bring out a reconciliation bill that can be jammed through with limited time and not an open amendment process from the point of view of amendments that have to be germane to the reconciliation instructions. So we don't have an opportunity to fix this bill. We weren't part of the process to develop the bill. You're not giving an opportunity for the democratic system to work. There was no on-ramp for Democrats to get engaged in the process. So about 2 weeks ago, maybe 3 weeks ago, I filed legislation and sent letters to my Republican colleagues telling them I want to work with you. I do. I've worked with Republicans in the Finance Committee on health care bills. We've gotten some good things done. Democrats and Republicans want to work together. So let's work together. The legislation I filed dealt with the two major problems that I hear as I travel throughout Maryland on what we need to fix on the Affordable Care Act, how we can make it better. Problem number one, we need more stability and competition within the individual marketplace. Yes, we've seen large proposed increases in premiums in the individual marketplace, not in the group plans, where most Americans have their insurance, but in the individual marketplace. And why? It's because we don't have enough people who have signed up in the exchanges. Younger, healthier people, because there really hasn't been any penalty imposed, have chosen not to join, and they'll say, look, we'll join if we have a need. We've also found that with President Trump indicating he may not fund the cost-sharing provisions that go directly to the insurance carriers that keep the premiums low and the deductibles and co-pays low, that he may not fund that also has a lot of insurance companies nervous. As a result, the premium increases are larger than what we had anticipated. We need to do something about it. How can we keep those premium increases at a more reasonable growth rate rather than what we have seen? And one way we can do it is a proposal that I believe has bipartisan support, and that is deal with what's known as reinsurance. Reinsurance is a way that we spread the risk over a greater group of people, therefore dealing with those high-risk pools in a way in which their premium costs are much more affordable. Another way we can do it is by Congress mandating that the president fund the cost sharings with the insurance carriers so that we don't have the threat that they're going to pull out those funds that are used to keep copays and deductibles lower. Another way we can do it is to increase our support for those that are of modest income in the funds that they have to lay out for their premiums. Because we know that you can make a good salary, but because of the cost of health care, if you don't have an employer providing part of those benefits, it's very hard for you to be able to afford that without some help. We can do all of that. Another thing we can do is bring more competition into the individual marketplace. We had those who have suggested a Medicare for all. We've had those who have suggested Medicare for the near elderly, 55 to 65 age group, or something similar to that. We have others who have suggested that we have a public option under the exchanges. All those, to me, make sense because it just brings in more competition. No additional government cost here because they're not subsidized any different than any other insurance plan, but it gives more options, more choice, more competition, and therefore more stability in the individual marketplace. We can do all that, and all that can help. The other thing what we really need to do is to deal with the overall cost of health care. And here again, Democrats and Republicans have had ideas. Why don't we take on the pharmaceutical industry? Why do Americans pay twice what Canadians pay for the same medicines that are manufactured here in the United States? Why don't we have rebates in the Medicare system like we have rebates in the Medicaid system? Why don't we organize our purchasing power in a larger pool so we can get greater discounts for the government taxpayers? All those things will bring down the cost of prescription medicines. The president's talked about it. Democrats and Republicans have talked about it. It's time that we act. And then, Madam President, we have acted in several areas to try to deal with more value-based reimbursements in our healthcare system, recognizing we should treat the person, not the particular disease. Many people have more than one ailment, and they have to go back to the doctor multiple times. Why don't we have a more coordinated, integrated care model? I talked on the floor about 2 weeks ago about the coordinated care model between Sheppard Pratt Hospital in Baltimore and Mosaic, which deals with behavioral health issues and how they deal with it in an integrated, coordinated care model, which saves money. It saves money, less tests, more timely interventions. How can we use telemedicine? They're using telepsychiatry. How can we use that to bring down the cost of care? So when I'm asked in my district, as in my state, as to what I can do, what is my plan, how can we fix the Affordable Care Act, my answer is quite simple. I'm proud of the progress that we've made under the Affordable Care Act. I invite Democrats and Republicans through our committees to work together to improve it. Yes, we can improve it. We can provide more stability in the individual marketplace. We can bring down the high annual growth we've seen in premiums in the individual marketplace. We can continue to bring down the growth rate of health care costs, working together on some of these common sense approaches in order to deal with health care in America. All this, I think we can do, Democrats and Republicans working together. But the first order of business, and I urge my colleagues, the first order of business is to stop this process of trying to jam a repeal of the Affordable Care Act and a replacement that would cost tens of millions of people in this country their health coverage, and we move in the wrong direction on how we should improve health care in America. Let's get that off the table. Let's reject this motion to proceed that the majority leader is talking about voting on later this week. Let's do what Senator Alexander has suggested, the chairman of the Health, Education, Labor, and Pensions Committee. Let's have hearings in our committee. Let's work together, and let's bring out legislation that stabilizes the Affordable Care Act and deals with the two major problems that the people in this country are talking about. That is bringing down the growth rate of premium costs and bringing down the overall growth rate of health care costs in America. I believe we can do both working together. The suggestions that I made, I'm sure there are others that members have. Let's work on those. Let's work together and get it done. And let's do what's in the best interest of the people of this country. With that, Madam President, I would yield the floor.